Hello guys, let me introduce myself first. This is Dr. Ravindra Savarkar. I did my MBBS and MD medicine from Grand Medical College Mumbai, and presently I am working as a director and consultant physician at Vedanta Super Speciality Hospital in Nagpur. Before starting this video, let me ask you three basic questions. Do you find it difficult to remember ECG changes of all the diseases out there? Or do you often confuse ECG changes of one disease with other diseases? Or do you often fail to form a diagnosis by reading ECG even if you can easily enumerate ECG changes of that given disease? If answer to any of this question is yes, then let me tell you the problem lies in basics of ECG. In my initial days of learning ECG, I did the same mistake, which you might also be doing right now. That is, ignoring basics and jumping directly on abnormal ECGs. I can assure you that your answer to above questions will definitely change once you learn the basics. With this, let's start. To help to get your basics right, I am making this series. In part 1, we will be learning about what are ECG leads, how they are formed, what are frontal and horizontal planes, and how these leads are arranged around the heart. Before going through ECG leads, first let's understand ECG electrodes. There are total 10 ECG electrodes, out of which 4 are applied on extremities and 6 on precordial or anterior chest wall area. Leads on extremities are color coded. Right arm electrode is red, right leg electrode is black, left leg electrode is green, and left arm electrode is yellow. This can be remembered with the mnemonic O, B, G, Y, where O stands for orange, which is similar to red. Precordial electrodes are numbered from V1 to V6. ECG lead is a combination of one electrode acting as a positive pole and one or combination of more electrode acting as a negative pole. Here I want to emphasize on the fact that positive pole is always formed by a single electrode, but negative pole can be formed by one or combination of more electrode in an ECG lead. There are 12 ECG leads. 3 are standard limb leads, which are lead 1, lead 2 and lead 3. 3 are augmented limb leads, which are lead AVR, lead AVL and lead AVF. Precordial leads are numbered as V1 to V6. Standard limb leads and augmented limb leads are called as frontal plane leads, whereas precordial leads are called as horizontal plane leads. You will get to know soon why they are classified as frontal or horizontal plane leads. Standard limb leads are the simplest one, where one electrode acts as a positive pole and one electrode acts as a negative pole. In lead 1, left arm electrode acts as a positive pole and right arm electrode acts as a negative pole. In lead 2, left leg electrode acts as a positive pole and right arm electrode acts as a negative pole. In lead 3, left leg electrode acts as a positive pole and left arm electrode acts as a negative pole. You must be wondering, where is the right leg electrode? So this electrode acts as a dummy electrode. Let's understand what are lead axes. Straight line joining negative pole to positive pole is called axis of the lead. Lead 1 axis is line joining right arm electrode to left arm electrode, which is placed horizontally and directed toward left. Lead 2 axis is line joining right arm electrode to left leg electrode. It is directed downward obliquely to left. Lead 3 axis is line joining left arm electrode to left leg electrode. It is directed downward obliquely to right. In augmented limb leads, one electrode out of right arm, left arm and left leg electrode act as a positive pole and combination of the remaining two act as a negative pole. In AVR lead, right arm electrode act as a positive pole. In AVL lead, left arm electrode act as a positive pole. And in AVF lead, left leg electrode act as a positive pole. As you can see, last letter in augmented limb leads gives a clue about which electrode is acting as a positive pole. Now let's determine the lead axis for augmented limb leads. But here we face a unique problem because only one electrode is acting as a positive pole. But there are two electrodes in combination acting as a negative pole. So which electrode should be taken as a point to draw lead axis? Or if neither of them is to be taken as negative pole, then which point to be taken to draw lead axis? This problem can be solved with the concept of Enthovian's triangle. With heart at center, if lead axis of standard limb leads, that is lead 1, lead 2 and lead 3 are placed in a shape of inverted equilateral triangle, then this triangle is called as Enthovian's triangle. Each angle of this triangle represent right arm, left arm and left leg electrode as shown in the figure. Now let's see how we can determine lead axis for augmented limb leads using Enthovian's triangle. For AVR lead, right arm electrode act as a positive pole and combination of left arm and left leg electrode act as a negative pole. So we take midpoint of line joining left arm and left leg electrode on Enthovian's triangle, which will be negative pole for AVR lead. And line joining from this negative pole to the positive pole will be axis for AVR lead, which will be directed toward right and slightly upward, more or less toward right shoulder. For AVL lead, left arm electrode act as a positive pole and midpoint of line joining right arm electrode and left leg electrode act as a negative pole. And line joining from this negative pole to left arm electrode will be lead axis for AVL lead, which will be directed toward left and slightly upward, more or less toward left shoulder. For AVF lead, left leg electrode act as a positive pole and midpoint of line joining right arm and left arm electrode act as a negative pole. And line joining from this negative pole toward left leg electrode will be lead axis of AVF lead, which is directed downward. Now let's imagine a circle around heart in frontal plane, that is vertical plane of the heart. If axis of standard limb leads and augmented limb leads are arranged such that each axis is passing through center of heart. As you can see, axis of lead 1 lies horizontally. So this is numbered as 0 degrees. And from this point, the circle is divided into equal 30-degree sectors. In lower half of the circle, below lead 1 axis, they are numbered positively like 30 degrees, 60 degrees, 90 degrees, 120 degrees, 150 degrees and 180 degrees. In upper half of the circle above lead 1 axis, they are numbered negatively like minus 30 degrees, minus 60 degrees, minus 90 degrees, minus 120 degrees, minus 150 degrees. Now as you can see, lead 2 axis is directed toward 60 degrees. Lead AVF axis is directed toward 90 degrees. Lead 3 axis is directed toward 120 degrees. Lead AVL axis is directed toward minus 30 degrees. And lead AVR axis is directed toward minus 150 degrees. This is the complete picture of frontal plane. For precordial or chest leads, 6 electrodes are placed over anterior chest wall, which are numbered as V1 to V6. Let's see how they are placed. V1 electrode is placed in right fourth intercostal space just lateral to the sternum. V2 electrode is placed in left fourth intercostal space just lateral to the sternum. Next we have to place V4, which is placed in mid-clavicular line in left fifth intercostal space. V3 is placed midway between V2 and V4. V5 is placed in anterior axillary line at the same level of V4. And V6 is placed in mid-axillary line at the same level of V5. Precordial leads are also called as horizontal plane leads because their axes are present in horizontal planes. Now imagine a circle around heart in horizontal plane. If we place precordial leads axis in this circle, they will be arranged like this. V1 being the rightmost, V2, V3 and V4 placed along the anterior surface of the heart and V5 and V6 along the lateral surface of the heart. Let's understand the position of frontal and horizontal planes with respect to each other with the help of 3D image floating in the corner. If heart is placed at the point of intersection of x, y and z axis, frontal plane will be formed by z and y axis. Horizontal plane will be formed by x and y axis. Axes of precordial leads are arranged in horizontal plane like this. Now this is the image showing all 12 ECG leads arranged around the heart in virtual 3D space. Our whole discussion till now was aimed at creating this image. But how this image will help us in understanding ECG? For this, imagine each lead as a camera recording electrical activity of heart from the angle of their lead axis. As you can see, lead 1, AVL, V5 and V6 are placed laterally and records electrical activity from lateral wall of the heart. Lead V2, V3 and V4 are placed anteriorly and records electrical activity from anterior wall of the heart. Similarly, lead 2, lead 3 and lead AVF are placed inferiorly and records electrical activity from inferior wall of the heart. If there is any problem in lateral wall, changes will be seen in lead 1, AVL, V5 and V6. For anterior wall, changes will be seen in lead V2 and V3 and V4. Similarly, lead 2, 3 and AVF will show abnormalities of inferior wall of the heart. When combined with principles of ECG recording, this image will be immensely helpful in understanding ECG pattern in normal and abnormal ECGs. Now it's time for me to throw some questions at you. My first question is, there is only one lead in which right arm acts as a positive pole. Which is that lead? If you know the answer, please write it down in comment section. If you don't, please watch the video again. My second question is about chest leads. In chest leads, whatever electrodes we are placing on anterior chest wall, they act as a positive pole. But where is the negative pole electrode for chest leads? If you know the answer, please write it down in comment section. If you don't, please watch the next video. In next video, topic covered will be conduction system of the heart, concept of vector of electrical forces, and how an electrode reads electrical impulse in heart. That means on what principle an ECG lead will show positive or negative deflection, and details about ECG paper. Thank you for watching this video till the end. If you have any query or suggestion, please write it down in comment section. If you like my work, please like this video and share it with your friends. To get notified about next video upload, please subscribe to the channel and hit the bell icon. Till next video, take care and keep learning.